I would now hand over to our president, Aziz Mehmet, for some house rules, any announcements he wants to make, and then introduce the speaker of today, Mr. Mehmet.
Okay, thank you very much. We will do the introduction as soon as the speaker gets in. But I just made one announcement that we have added one additional group, dedicated to communicating and sending out messages on WhatsApp. Social platforms are very popular, so we thought we will use this also, that we normally were sending messages on email. So now other than that, we will be using this WhatsApp also to send out that meetings and the change in meetings and whatever the information is required by our members. So before our minister gets in, a few in-house announcements are that we would be having the IPSC International Public Speaking Competition. It will be virtual starting on 10th May to 14th of May. And our participant who would be representing us in this competition in London would be Sameer Ali Shehzad of Lahore Grammar School, Islamabad. He was the winner of the Ahmed Jafar Cup also, and the cup was presented to him by no other than President of Pakistan, Dr. Arif Alvi. The second announcement I have is that we are launching a book. The name of the book is Treasured Memories, written by His Excellency Shahid Hamid, former Governor Punjab and former President ESUP Lahore chapter. The launching ceremony will be held on Zoom on Monday, 26th of April at 11 a.m. Kindly join us. We have received 23 signed books with the name of the person to whom they would be delivered. Like, the governor has written, "My dear Bakhtiar," and with best wishes, and has signed. Like Bakhtiar asked for 2 books. So we got 1 book in his name and 1 book in the name of his father, Naveed Khan. And so, with these books are on their way to you. 23 have been received, and this have been offered to us by Shahid Hamid at a discounted price. We are thankful to him. On the 6th of May, we have the Australian High Commissioner, His Excellency Jeffrey Shaw. Jeffrey Shaw, he would be talking on Zoom to us from Islamabad. His topic will be announced later. And then on the 31st of May, we have the Chief of the Naval Staff, Admiral Amjad Niazi. Admiral Amjad Niazi will be talking to us in person. He is the officer in uniform, so he will come in uniform on Monday, 31st May at 5 p.m. at Beach Luxury Hotel, and we have the huge hall booked. So SOPs will be duly adhered to, and the chairs will be kept very far away from each other. Please wear your face mask, and only boxes will be given. If tea, coffee will be given, it will be in paper disposable cups. So these are the few events which are coming up, and we hope that you'll be able to join us. As soon as the minister joins us, we will be starting with him. And
Assalamu alaikum, Mehman Sahab, I'm here.
Oh, okay. Sorry. Assalamu alaikum, sir. How are you?
Very good.
It's a pleasure, Dr. Faisal Sultan, to welcome you, Prime Minister Advisor on Health. We understand that you have a meeting with the Prime Minister. I have got your 3-page CV in front of me, starting from King Edward Medical College and going on to Connecticut and being a specialist on infectious disease, and then coming back to Chaukat Hanum Hospital. And now, since you have taken over, you have brought a drastic change in the polio program. And we just got the confirmation that in the last NID round, 40 million children have been given OPV. And I just wanted to add, Dr. Faisal Sultan, that although it is a very odd time, but our International Polio Plus Committee Chair, Mike McGovern, who is not a member of our English-speaking union, but he is listening as an observer. So I will not take your time by reading out your profile. Everyone knows that what you are doing at this point of time, you are handling the most crucial work, the most critical work, the pandemic which has not shaken up Pakistan, but which has shaken up the whole world. And we, with our limited resources, are facing it very bravely, courageously. The curve goes up and down. So I will not talk about that. I'll hand over to Dr. Faisal Sultan. Over to you, sir, Minister.
Thank you, sir. It's very kind. It's been a dual challenge, I think, or I should say a multiple pronged challenge. We, as far as COVID is concerned, we continue to be living through the third wave, essentially, which is showing no signs of relenting so far. And when we look at the situation in neighboring India, as well as in Bangladesh and other countries in the region, it seems like we're all in an upsurge or an uptrend at this time. We, of course, for polio, we while this wave was, coming through, there were some who thought that we could or we should put some prioritization, is perhaps the best way I can say it, of resources between COVID and contact tracing and testing and polio. But we were very clear that this is a special challenge, but we've got to do both. And we've got to fight this on multiple fronts, and that the polio program and the immunization program ought to go through no matter what. And we were confident that we were able to do both. And I think that did come through. We've had a reasonably successful campaign, at least in terms of the numbers that we have at this time. We had a little hiccup in Balochistan because of the strike, but I think finally that also got sorted, and the campaign in Balochistan got initiated and became underway. So, and as far as the COVID is concerned, we are currently trying to make sure that we add some NPIs, some restrictions and enforcement of some existing ones to ensure that we can actually squelch this current spike, which seems to be hovering around a number that is higher than whatever we've experienced in the past, including the first big wave in the summer of 2020. In parallel, we are trying to obtain as much of the vaccine as possible and to roll it out in an orderly fashion. So right now, people between the age of 50 and 60 can register and are eligible to be scheduled for vaccination. So that process has started. We've had nearly 1.6 million doses given so far, but that's still a drop in the ocean because we have about 100 million people that are potentially eligible for vaccination. So we have ongoing procurement and ongoing supply of the vaccine that continues to arrive. There should be a plane load arriving today and then another one in day after tomorrow. And then by the end of the month, we should have around 2 million additional doses. And then subsequently in May and June, we will have between 4 and 6 million doses for both of those months. So while our campaign will continue, we do need to ensure that we have continued high supply to enable our target of 50 million approximately or more by the end of this year, perhaps even a higher number than that. In addition, we are constantly working to ensure that the preparation and build-up of the healthcare system is there, and that the pressure on oxygen is duly managed. It is going to be a challenge because, as you know, perhaps that even in India, they're currently facing some serious pressures on their oxygen supply and logistics. So these are the present challenges, and of course, this is all in parallel and at the same time, over and above the normal day-to-day and some strategic interventions that we are trying to put together. In terms of infectious diseases and polio, I can tell you that yesterday, the first board meeting of the new NIH happened with Professor Zulfikar Bhutta in chair. And the idea is to revamp and redo the NIH into a very vibrant organization with a health laboratory, national health laboratory, with a CDC, a Centers for Disease Control, with a health data center, as well as a vaccines and biologics centers. These are 4 amongst a total of 7 centers in the new NIH that are being put together. So this is where we are. I could go on, but just to give you a very quick overview of where we are, I thought this would be useful. And if there are any thoughts or questions, I can certainly respond to them if that is allowed per your format.
Sure. Pleasure.
Thank you, Dr. Saab. I know the time is very short for you also, but what we will do is I will hand over to President Aziz Memon. He will moderate the questions or comments that arise. And please, those who are logged in, please raise your hand, just click on the button so Mr. Memon can, contact you. Over to you, Mr. President.
Thank you. Majid, if you can check on the chat box, there's some questions coming up. If there is any, otherwise I will. Yeah, okay. Mr. Kaleem Faruqi, Vice President, may I have the first question for Dr. Faisal Sultan.
Honorable Special Assistant, a fantastic job being done by your team. There is no doubt about it. With the availability of the vaccines, I've been one who have got both the doses. But what is of concern is basically the wave coming up in from the neighboring country. I've been watching what is happening there. People are still not taking it seriously. The wearing of masks, the social distancing, this is something very drastic has to be taken up with by the government. I have seen clips where, the policemen are given sticks to beat the people who are not wearing it. That's the way I think we should go forward. And I have also recommended this to Asad Saab and others, but there has been no response. But there is a definite need for people to understand the severity of the problem. Any comments, sir?
Absolutely. I think that we can do all the vaccine we want to, but in the short term, the real solution to this is to quench the heat, the way in which the epidemic is spreading and going on. And I do not think that without the kinds of things that you have suggested, any dent can be made on that side. In fact, exactly in line with what you are saying, there is an NCC meeting tomorrow to bring together 2 ideas and 2 interventions very seriously. One is to seriously and rapidly improve the enforcement of mask wearing and other NPIs. That's one. And then any other measures to stop the flow of disease. which may include additional NPIs. So we have an NCC tomorrow with the Prime Minister in chair, and we do hope that you will see some of what your desires are come out into decisions tomorrow, inshallah.
Thank you, sir.
Next
Thank you.
question from Moin Fuda.
Yeah, next
Miss-
question, Mr. Moin
Miss-
Khuda, and then we have Bakhtiar. Moin Khuda, go ahead.
Mr. Minister, sir, I'd like to firstly compliment you for a way that the NCOC and you have handled this crisis. More importantly, I think the issuance of a certificate is a milestone for Pakistan because, in America and elsewhere in the black market, these certificates are being sold for $250 without vaccinating. It's a great job that you have done. What I like to observe here that I was the first one with my wife to have got the Sputnik vaccine. We got the second dose yesterday, and somehow or the other, when we got the certificate, both vaccines on the same day. And I'm struggling to get this changed, but it's a bit difficult task, I guess. So maybe you can line up the hospitals or NCOC portal to do something. What I'm also suggesting, Mr. Minister, sir, is that these private vaccines are very important. This is a month of holy month of giving zakat, and I have personally launched with friends and with Mr. Mehman the zakat for vaccine drive. So private sector needs to come and play the role. Let the people below 50 get the vaccination through private sources, companies, and others. So this needs to be expedited, Mr. Minister, sir. And I really appreciate your input as to the private vaccine because 25,000 doses of Sputnik were not sufficient, and some of the hospitals have orders now. OMI in Karachi has got 800,000 people in waiting. So it's a big task. Please share us with your views on the private vaccine.
Right, sir. On the vaccine certificate, first of all, so the data as entered will show up in the certificate, unfortunately, and if the data entered is incorrect, then that's what will show up. We have set up a little mechanism to fix these because obviously at the point of entry, when there are thousands of people, you can have some errors. There have been people who've actually gotten 2 doses, but only one is showing up because somebody, while typing in their NIC, missed a digit or added a digit or so on. So I will ask Mr. Aziz Mehman to pass on your contact to me, and I'll have that addressed at the back end. About private procurement, we are from the government's perspective, we allowed it just for the purposes that you mentioned, which is that some people may require it in a time frame which is different from what their age cohort might get it in. So travelers, students going abroad, businessmen, people seeking jobs, etc. So we have made that provision, but the real challenge to me so far has been that the actual availability has been very patchy. So even for private procurers, it is very difficult to find adequate number of doses. But I do feel that even from the public sector perspective, from the government's vaccine drive and initiative, we have, as I mentioned, nearly 2 million doses coming in before the end of April. And then again, I would say, if I would just round off the numbers, between 4 and 6 million monthly for May and June. So I think that the government's procured vaccine would be able to reach many millions. And so even if the private procurers are unable to get enough doses, hopefully if they're in the right age range, at least people would start to get it. We've opened the portal for the 50 plus, as I mentioned, and people are getting that vaccine. But there is a little bit of a dilemma. At one end, we have people who are registered, which are only a subset, relatively a small subset of those that form the actual population in that age range. And then even amongst those registered, would you believe it, that those scheduled, only about 50% actually show up. So it's a bit of a challenge. On one hand, we have shortage, and on the other hand, we have some mismatch of ask and where people are getting the vaccine. We're trying to solve it, But as far as private is concerned, we have no bar. People are trying to get it, and small procurement is happening, but not in the fashion that one would expect it or want it, I should say. We're expecting that there would be tough procurement situations because there are too many askers for it and not enough supply.
Thank you. Next question is from Mr. Bakhtiar, our member of our National Executive Committee. Bakhtiar.
Assalamu alaikum, Dr. Saab.
Walaikum
Good to
assalam.
see you looking well after your COVID infection. I hope it was not very severe. Couple of observations for you. Now, both I and Zarmeena got our vaccinations. The second dose is from Dubai, the Chinese vaccine. And 2 weeks back, Zarmeena went down with all the symptoms of COVID. Can you hear me, sir?
Yes.
Hello. Is my voice coming through, Dr. Saab?
Gigi, I hear you. There's just a phone ringing.
Hello?
I'm trying to sort it out. Please go ahead.
No worries. So we got our COVID vaccines 2 months ago, the final dose from Dubai, the Chinese vaccine. And Zarmeena came down about 2 weeks ago with all the symptoms of COVID, with body pains and temperature. But twice we got the testing done, and she came out negative. So is there a strain here which has the symptoms but doesn't come in the reports? Have you come across such a strain in Pakistan?
Okay, let me try to respond. Well, first of all, thank you for your kind wishes. No, I didn't have COVID. I actually, because of exposure, close exposure to the Prime Minister at that point, I had decided to isolate myself and got tested just to ensure that I wasn't carrying the virus. So no, I've been well, shukr, alhamdulillah. Now about contracting what would sound like or feel like a viral illness after having adequate doses and not testing positive for COVID. The most likely scenario, in my view, is that you are immune to the disease, and that whatever second infection that happened and that was negative for COVID by PCR was likely another viral infection. Many viral infections behave very, very similarly, and therefore I think in a pandemic can cause immense confusion. So I think that's what it is, and I would continue to hold precautions, but I think remain quite confident that inshallah you've got about 80% protection, which I assume that the vaccine you received in Dubai was Sinopharm. So it's got about a 79-80% protection rate.
Yes, it was. Thank you very much. Thank you.
Thank you. Naeem Farooqi, would we have the next question? Naeem Farooqi. Mr. Naeem Farooqi.
Yeah, Dr. Saab, it's nice having a meeting with you. Just wanted to know, in the first wave, we had a very good administration, and we did control that very well. In fact, the entire world applauded us. Why is it that this time we are unable to control? In fact, I would say that it is out of control right now. Is it because of the strain that is very relatively new to us?
So that's a very important question. I think it's got two important factors that are inputting that we know. Two important factors that are inputting into it that we are aware of. The first, of course, is that it is quite possible that the B117 strain is a little bit more contagious and therefore is playing some part. That's one. But I really think that no matter what strain is in the community, if the community does not take precautions, then the disease is bound to spread. And on the other hand, no matter how contagious the strain, if the compliance to NPIs and masks is high, then the disease will automatically come down. I think what has happened is really a mental fatigue on part of the public, as well as enforcement fatigue on part of the enforcers. both things have happened. And then, of course, the presence of the perhaps a newer variant within the community. I think both these things have contributed to the spread of the virus. Additionally, I think there may be other factors which include things like, innate immunity, how the weather plays out, mobility, inherent mobility changes beyond just NPIs that may have occurred because of this being in the spring, and other things that are unknowns. And until we actually are able to analyze, I wouldn't be able to say much. But the two things that I would say which have contributed are a complete disdain for any caution, plus a new strain which is somewhat more inherently more transmissible.
But Dr. Saab, we have the same set of people this time as we did last time. So, what's the difference? It must be just the strain that we have.
The difference, I think, is that a year of getting sick and tired of being asked to restrict ourselves and so on. I'll give you an example. Last year, one did not have to, during the same time period, one did not have to really convince people that, look, this is a serious disease. Stay inside. When there was a lockdown or a set of restrictions, people were much more compliant. This spring, it was almost unbelievable. I mean, starting in Feb, I think this huge upsurge in weddings, etc., and perfectly literate and educated people are just throwing caution to the wind. I think that it's just human nature, and it's something that's been seen elsewhere in the globe as well, where people have a certain appetite for restrictions, and after a time period, it takes much more effort to enforce. But again, it's still a conjecture. I would agree with you that there may be other factors playing in that we may not be aware of.
Thank you very much, Dr. Saab.
Thank you, Minister. The next question is from our life member, Nadeem Kazmi. Nadeem Kazmi. Nadeem Kazmi, are you there?
Go to Mustafa Farooqi.
Mustafa Farooqi, and then Dr. Shaista Effendi. Mustafa, Dr. Shaista Effendi.
जी सर, अस्सलाम वालेकुम डॉक्टर साहब, ये मैं ये पूछना चाह रहा था कि अभी बेसिकली ये जो वेव्स आ रहे हैं, ये पहला आया, दूसरा आया, तीसरे पे हम आए हुए हैं, तो ये कोई फोरकास्ट है इसमें कि कितने वेव्स आएंगे कि ये खत्म हो जाए जब तक, or are they just waiting that people will get the majority will get immunized and then hopefully hospitalization will not occur?
Farooqi Sahab, that's a question that is on the minds of everyone. Just this morning, someone asked me this and said, well, what do you think? Look, if we look at historical records, pandemics of this nature have usually had between 2, 3, 4 waves or wavelets, and have eventually died out. Primarily because then by that time enough population has had the disease and there is an inherent innate immunity. Sometimes people call it herd immunity or community immunity that exists, so that the disease finds fewer and fewer people to be able to infect who are susceptible. What can be said about this one? Really, I don't know, because I think that again, it is likely to follow a similar path, and it will take about 1.5 to 2 years to finally die down, starting from the time that it was started. What will certainly help is mass vaccination, but given the fact that a lot of countries have had no vaccination or very little vaccination, and the fact that there are many richer countries that have plenty of vaccines but are probably safekeeping them for future use, means that until and unless a very large part of the global population gets vaccinated, the vaccine effect into the herd immunity will take a few months to kick in. So I think that one hopes that this third wave, which is more or less what most of the world is experiencing, would be it. But given these new strains and some of them being more transmissible and not really less virulent, is the concern. So I think no one can answer your question other than just looking at historical records, especially of the great flu of 1918, 1919, and say that it'll take about 1.5 to 2 to completely go away.
Thank you.
Thank
The
you.
IPPC chair, Mike McGovern, has got up early in the morning to listen to you. Mike McGovern, do you have some comments, suggestion for our minister? Mike?
Yes, very briefly. Thank you, Aziz. It's an honor to be with the group today, and particularly with the special assistant to the Prime Minister. Yeah, I'm sitting here, and I'm hearing about the number of COVID vaccines that you're going to have available. And I know you're doing the best to procure, but Rotary got involved in immunizing children against polio because we thought it wasn't right. There wasn't equity in everyone getting vaccines. And as I hear the numbers in Pakistan, I worry. So I'm so pleased that you've urged, continue masking and the other precautions, because everyone does need to take this seriously. Just very briefly, I was in Pakistan February of last year, and your predecessor was dealing with the students in Wuhan from Pakistan and about whether to bring them home or not to bring them home. And it just, back then, people didn't take it seriously, and fortunately today people do. So I want to thank you for your leadership, all you're doing, and very much appreciated your remarks this afternoon. So thank you, Dr. Faisal.
Thank you very much.
Dr. Shaista Effendi, are you there? You wanted to ask a question.
Yes, I am here, and I'd like to say salams to Dr. Faisal. Very nice to see you here again. I want to congratulate the method in which you all have installed the vaccination program, and it has been done immaculately well, and it has been recorded very well. So congratulations. There seems to be a mental health issue internationally. There's a resilience, and there is a resistance and a denial to the fact of the virulence of this particular virus. And educated, knowledgeable people will refuse to wear masks. They will insist of having little joint meetings when they know that there is this communicability of this virus from person to person, and there doesn't seem to be any system or method of its communication. And I really feel that there is a need to educate the students, the younger generation, and also the moms of the homes to the importance of simple masking and distancing. And countries that have done it out of their own conscious responsibility, they have been very safe. And people who have not done it, they have not been successful. And vaccinations will never be enough, because it may be like the influenza virus, where you need to keep revaccinating yourself. So the initial phase really requires masking, distancing, and stopping most of the get-togethers as much as is possible internationally. Every flight that comes in, every vehicle that comes in, carrying people from one place to another is literally a potent, mass exposure. So thank you so very much. That's all that I had to say. And you need to hold some sort of a research on the mental health side of it, of this resistance and denial. Thank you.
I completely agree. I think the key to this may be in the mental health domain, I think, and behavioral sciences, because this disdain is widespread, and vaccines alone will not sort it unless people actually change behavior. I agree completely.
Yeah. Aziz, I want to make a point here.
Yes, please. Go ahead, Majid.
Dr. Saab, I also had my 2 jabs, and I from day one, I'm feeling normal, mashallah. The first point is, why are people afraid of the vaccine? I'm thinking of writing an article, because the way, like somebody also mentioned, the intellectuals, the intelligent people who understand everything, they've been asking some frivolous and very, very juvenile questions regarding the vaccine. I can understand if somebody who's maybe illiterate or ignorant or living in the hinterlands or in the villages, he may have some issues. In fact, one of my drivers, is over 60. I said the reason I will not go is because I won't be able to produce children. And I told him, now at this age, how many children do you want? Now my basic point is, there's always something to learn from adversities, especially for Pakistan, where we usually have national, disasters and hazards. This is one crisis where all of you have got together, whether the government, whether the armed forces, whether the other security agencies, on a single purpose. So I think this should really be the blueprint for Allah na kare, if there is any other kind of hazard or natural disaster in the future. This experience that you all have learned, and most of the citizens have learned, should go a long way in handling the crises that are going to come in the future, which Allah kare nahi aave, but we have to be very practical. So I think this is maybe one of the reasons for all the hard works of the teams and the government is, of course, that we are now ready for any kind of just disaster that Allah kare should not happen. Thank you.
Thank you, sir. I agree. I think the hesitation stems from, I'll give you a little example. We opened the portal for 4 weeks for healthcare workers to get vaccinated. No age bar, and really you could be any part of the health system. You could be a receptionist, you could be a doctor, a nurse, physiotherapist. And 180,000 people did register and are getting vaccinated. But then when we closed the portal, I started getting some noise and people saying, well, look, where is the healthcare portal? And I said, well, we opened it for 4 weeks. A lot of people spent their time either in procrastinating or over analyzing or just getting fearful of the vaccine for no reason. And so, as you perhaps know, we opened it again yesterday and we have a few thousand more healthcare workers who have signed up. So I think the role of social media and misinformation is tremendous. 2 days ago, we put out a little tweet with some graphics from the health ministry side, which I actually had done it personally, but we put it out from the ministry side. And then I had run it by my infectious disease colleagues and I've retweeted it about the don'ts. And, you'll be shocked the number of things that ought not to be done that are being done. Antibiotics unnecessarily, steroids without somebody being on oxygen, CT scans without reason, antibody tests without any benefit of doing them, and a bunch of other things. So unfortunately, this is like war, and you've heard that famous saying that the first casualty of war is truth. So I think this is what has happened. But again, it comes back to what Dr. Effendi just said, which is that it's in the behavioral sciences and mental domain. I really think that we haven't done, if there's one area that we haven't really done enough on, is trying to understand the behavioral science part of it to see how it affects our reactions and responses. So I think I've written it down. I think we need to do a little bit more on this.
Thank you. Mr. Naveed Khan, short next question. Naveed Khan.
Yeah, my question is very short. It's not a question, it's just a request. There seems to be an antagonism between the province that we live in and the center. And as a result, this province here is not taking up any steps to enforce the SOP. Can this coordination between the center and the province be improved so there would be better thing of the SOP? Anything I wanted to ask has already been asked, so I think that's all I had to say.
Thank you, Mr. Naveed. Watch the news tomorrow after NCC. The problem that you have identified is precisely what we are trying to solve. And inshallah, I am hopeful that this coherence will be regained.
Great.
Thank you. Bakhtiar, you have another short point you want to say, Bakhtiar? Bakhtiar?
a quick observation, Dr. Saab. You already touched upon it. The people are getting antibody tests done. Now, a lot of them are coming out to be negative even after the second dose and even after a couple of months having passed. Does it mean that those persons need a booster jab? Is it safe to get a booster jab having negative?
Okay, let me just explain this. And this is one thing I got misquoted in the media for. At this time, if you've had 2 jabs, you're good. The desire to know whether you are actually immune or not is understandable. It's a natural thing. You've had 2 doses, a pandemic is going on. One says, okay, am I immune or not? Have the vaccines worked or not? And there's a natural desire to ask this question and to be able to have a measurable, tangible, numerical answer. Now, this desire is understandable, but I can tell you that this desire is not going to be met by doing the antibody test. I gave this example to someone the other day, that if one were to measure, let's say, the military strength of the country, and the only thing you measured were just the number of airplanes or the number of artillery pieces or tanks, would that actually give you the full military strength of a country when you're not counting soldiers, training, ships, tactical, nuclear devices, and economics and fuel supply lines and commitment and leadership. So in other words, the immune system, our immune system in the body, is just like that. It's a complex, sophisticated system in which trying to measure one component, and that too not very well, just antibodies of what, is likely to mislead and confuse us. In fact, let me tell you that when trials are done, and this is a very important point, when vaccine trials are done, and this is exactly what was done in all these trials that for the current vaccines, measurement of the antibodies is a very secondary matter. The real thing that the trial does is say, create 2 groups, a placebo group and a group that received the vaccine. And what we see is development of disease and serious disease and death in one group versus the other. So what does it tell you? That the real outcome that we are measuring or asking for is the bottom line, is the hard outcome of development of disease or development of serious disease or, God forbid, death, comparison of that in one group versus the other. Nowhere does the antibody measurement come in. So some of this desire has been fueled by our doctors because, for sometimes for want of full knowledge of this, think that doing the antibody is going to help them. So we're trying to debunk this, but it's unfortunately, how do they say, ghalatul aam jo hai na, wo ho gaya. This is just, it's gained deep traction into society, and it's going to be not easy to unroot it.
Thank you, Minister. Acceptability of the vaccine is a question you can ask to the polio workers also. We have been trying to get over for last 43 years, and this social wrong messages, religious wrong messages have prevented 2 countries only now, Pakistan and Afghanistan, to become polio free. But I'm sure the way we are going, and if you look at the graphs of last 6 to 8 months under your leadership, we will be able to get over polio, and we will be able to defeat COVID. May I request Kaleem Faruqi, our Vice President.
Mr. President, I just have one observation, Moin Fuda.
Sir.
Mr. Minister, sir, I represent New Zealand and Pakistan. I'm the Honorary Consul General, and they're getting the reports from me, and they think that Pakistan is doing a great job. So it's a compliment. What Dr. Fauci and you're half of the age of Dr. Fauci. American population is 325 million. Pakistan is 225 million. With limited resource, you're doing a great job. What I suggest is that twice a week, maybe you need to come on the TV to take a telethon and answer questions of the people, because NCOC is doing a great job, but then you as a chief medical advisor of the Prime Minister and you are the face of the Pakistan, you need to come for an hour twice a week maybe and do some motivation to the people. and answer their questions. They will take it seriously, sir. Thank you.
Thank you.
Thank you, Mr. Moin Fuda, for the good suggestion. May I now request Mr. Kaleem Faruqi for a vote of thanks, because I can see that Dr. Faisal is looking at the watch. I know you have a busy schedule. I very well understand. We are grateful to you for your time, for your patience. Mr. Kaleem Faruqi for a vote of thanks.
Dr. Faisal Sultan, sir, thank you very much. To be honest, I was a little nervous whether you will be able to make it for this meeting because of the situation the country is facing and the Prime Minister calling you off and on to see what the situation is. Thank you so much for sparing your time. It's a serious matter, but like most of the participants have expressed the fear, is the people who need to understand the severity of the problem. And I hope that the meeting that you're having today or tomorrow, whatever you're saying, you come out with some measures that will bring sense into the people on the street. That is important. Thank you so much again for your time, sir.
Thank you, sir.
Dr.
I'm
Saab.
grateful and honored. It's been a pleasure here, and I apologize for a little bit of the hurry that I'm causing, but I truly have to sign off and go. Thank you very much, and a good afternoon to all of you.
Good luck
Thank
to
Thank
you.
you.
Good
Thank
luck
you,
to
Dr.
you.
Saab. I declare the meeting closed.
Thank you. Assalamu alaikum. Thank you. Thank you.